The fertile ground of the highlands of Western Kenya hide the shocking statistics of rural poverty in this area. We have used key health indicators to help identify the areas in most need. Those indicators include cholera, under 5 mortality and maternal mortality. A baby girl born in this village today has a life expectancy of 55 years. The baby girl will have a 1 in 5 chance of dying before she reaches her 5th birthday. The mother who delivers this child today has a significant risk of death in the next 48 hours. Over the course of her reproductive lifetime of 6 or 7 pregnancies, she has a 1 in 16 chance of dying.
Friends of Londiani has worked in this area for the last 10 years, working in the field on community-based projects.
We really work with all the leaders in the villages and all the government officials. We work with the Ministry of Education, we work with the Ministry of Health. That is why we are accepted in the society, because we don't work alone. And also we work with the village leaders. They give us the needs of the village. We decide together and we go ahead and we do it.
All our projects are partnerships. It's not 50-50, say financially wise, but it certainly is 50-50 with the working, with the planning, with the implementation.
We may be able to give knowledge and advice from here, but the real expertise lies with the local people, because they're the people who live it. They're the people who know what they need, and generally they know how to get there. It's just they don't have the facility or sometimes the knowledge to be able to get there, and that's what our role is.
For programme effectiveness, our work is concentrated on 3 areas. We've water and sanitation, education and health, particularly the health of women. Women are key here to the success of all communities. They're the bedrock of communities, for want of a better word, in lots of aspects, and that's why girl education is important, that's why maternal health is important. They're the key earners in a family, they're the people who till the land, who carry the water, and so their health is a key issue for us in Friends of Londiani.
Londiani Hospital, or Kipkelion as a district, has been a hardship area. The infrastructure in terms of road, the poverty levels in Kipkelion are quite high. There are no hospital facilities which are fully functional. So most patients who are in Kipkelion, which is about 46 kilometers from Kericho, would have to come to Kericho District Hospital for services. There was need to improve the facility in Londiani so that it can serve that community.
Maternal health refers to the care and the outcome of the mother during pregnancy and delivery and for the few weeks after delivery. Your measure of maternal health very much reflects poverty amongst women, education opportunity amongst women and gender equality or inequality. Our programme at facility level is to increase the capacity of the staff to respond to emergencies, to provide them with some essential equipment and to bring the district hospital up to a level that can provide comprehensive obstetric care. We work, even though we're a non-governmental organisation, we work very much in parallel with the Ministry of Health. The ultimate aim for sustainability is to build enough capacity amongst teaching medical staff that they would be able to train internally. The Healthy Homestead is a local level example of very good public health. The idea is that those living in a homestead have the possibility of having a healthy lifestyle. It involves access to clean water and access to frequent hand washing. It also involves separating sanitation in having a pit latrine, which is preferably ventilated. The preparation of food, food hygiene, and the washing of dishes after food is also given a special area. The cooking is encouraged to be carried out with a smoke extraction. The kitchen garden provides suitable nutrition and well-balanced diet.
The Healthy Schools programme is based on having a student committee within the school who accepts responsibility. Maybe they're voted in by their peers or selected by the teachers. And their responsibility is to educate the other students about healthy practices and to organise activities which raise awareness of it. And then they would set about setting a target, for example, to build new toilets or to put in hand washing facilities or maybe to have a litter collection every week and to clean the classroom, whichever, depending on the needs of their particular schools.
When major activity that has been done by Friends of Londiani is the introduction of field days. In the field day we've been having several stands. That is from MCH that deals with the mother and the child. We have nutrition. We also have water and sanitation. That is where we teach people about water, clean water, how to clean their hands, the use of pit latrine. We also deworm people during the field day. And then we also have a stand on malaria, whereby we give them nets, we teach them on the importance of using treated nets. Then we also have a stand on HIV/AIDS.
What we are doing now is every month, once a month, we go for field day. We have a stand for female circumcision, and we give awareness of those things that are dangerous towards female circumcision. So immediately when they close school, we have 1 week training for all the girls. We also give awareness to the women and the old women, and even the men also, because the men are also involved. They say, if a girl is not circumcised, I'm not going to marry. Or if he marries, then she will still go for circumcision. Last December, we were able to train 50 girls, and we have succeeded. And the girls now in school are saying no to circumcision, many of them.
We don't really have shortage of water. It has been flowing throughout. Initially, people had to travel a lot, travel far to go and fetch water in the rivers. And the water even in the rivers was not good water, because that's where animals went to drink their water. That's where people went to wash their clothes. And that's where people fetch water for drinking and even cooking.
The day we turned on the pipe for the water in Dubasat in 2006. And we had assisted the community and worked with them in putting in 6 kilometres of pipes from the mountains. And it had taken months and months of people digging the pipes, putting them in. We piped it into the clinic first. And the day we were there, when we turned on that water, I will never forget. They danced in the water, they sang, they celebrated all the way through the night. And it was just the relief and the difference that just a pipe of water makes. When we went to Dubasat first in 2004, they wanted water. Water was their key aim, water and maternal health actually, and so we put in the water project. Now if you looked at the stats of the school, and if you looked at the number of girls in schools and the number of children in schools, the number of girls was 20–30% of the school population. And why? Because they spend their time collecting water, and they have to travel 5–6 kilometres, some of them even more, to get water every day, so they can't go to school. We put in the Dubasat water project with the community, and the water was turned on in February 2006, and we're now building a girls' secondary school. I think that speaks volumes.
Knowledge is power, so if we really teach them, they will do it.
Free education came into Kenya in 2003 and 2004. And what that enabled was that there was no fees to attend primary school initially, and then since then it's come in for secondary school. However, you still have the costs of a uniform, of school books, of the school lunches, and then you still pay a fee to the school towards the development of the school, or for example to pay for additional teachers. And so there are still fees associated with sending your child to school. And the vast majority of the communities where we work in rural Kenya they just can't afford those fees for all their children. We've been doing a lot of projects with both giving out bursaries to needy children, in particular to orphans or children from one-parent families, and then also looking at trying to encourage people to save, to set up little co-ops so that they start saving. When the child is born, they're not going to know 5 years' time this kid's going to go to school.
Parents have difficulties in paying fees, so you get a child going home, and then when they come back again, they might come with little money, which will make them stay for some time, and then they will go back. So you will see the education here will not be continuous. But when they are given bursaries, they are able to continue.
What we were trying to do was to give some of those disadvantaged children an opportunity of secondary school education. The interest they had and the ideas they had and the ambition that some of them had against all the odds was overwhelming.
Usually this is how we start working in a community. They invite us in to do this life skills course, and it's done by a mixture of Irish and Kenyan trainers. And the course is about a lot of sort of general basic healthcare issues and relationship issues that communities might have, but also people within their personal life might have.
When you see your neighbor achieving better things in a very simple way, you'd strive to be like them. And Friends of Londiani have put up projects that are looking like glowworms in the dark. And so every glowworm that is hidden beneath the leaves would try to also shine out, be seen. And I think that is one of the best things Friends of Londiani are doing.